Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode number 92 of the Better Health Guy blogcast series. Today's guest is Dr. Lu-Jean Feng, and the topic of the show is breast implant illness. Dr. Lu-Jean Feng is an internationally renowned microvascular, plastic, and reconstructive surgeon. She is the founder and medical director of the Lu-Jean Feng Clinic. She graduated from Yale College and Yale Medical School and has been involved in medicine for more than 28 years. She is unique within her field as female plastic surgeons comprise a very small percentage of the total industry due to the intensity and length of training required. Dr. Feng is widely recognized as an artist, surgeon, and visionary for her many endeavors in the medical field and for her ability to help patients improve and maximize their overall health and well-being when all other avenues have failed. To date, Dr. Feng has patients from every state in the U.S. and from 34 countries around the world. Over the years, Dr. Feng's own personal beliefs and ideals regarding fitness, nutrition, and healthy living have evolved into every aspect of her practice. The Lu-Jean Feng Clinic opened in 2000 as a premier state-of-the-art outpatient surgery center. Today, the 15,000 square foot three-story building has been transformed into a total health and wellness center, incorporating many beneficial services under one roof: preventative medicine, medical-grade skincare services, laser treatments, infrared sauna, cryotherapy, ionic foot bath detoxification, therapeutic massage therapy, FengFit Cafe, and a unique fitness center complete with personal trainers and group fitness classes. In 2011, Dr. Feng developed a line of healthy plant-based foods under the name FengFit Plant-Based Cuisine. All surgery patients receive 1 quart of Dr. Feng's highly nutritious fresh soups of the day, along with Dr. Feng's signature salad upon discharge from the facility following their procedure. She has very high ethical standards and is a masterful technical surgeon who pays close attention to the most minute details and takes great pride in her work. Her latest pursuits involve helping her patients reach total health and wellness through her highly specialized lifestyle and bioidentical hormone replacement therapy programs. Dr. Feng's ultimate goal is to guide each and every patient to a more optimal state of health through proper nutrition, rigorous exercise, vitamins and supplements, and replacement of essential bioidentical hormones. In other words, total and optimal wellness from the inside out to ensure vitality, slow down the aging process, and provide protection from disease. And now, my interview with Dr. Lu-Jean Feng. In many cases of chronic complex illnesses such as Lyme disease, mold illness, chronic fatigue syndrome, fibromyalgia, MS, or other conditions, the exploration to regain health often needs to be very broad. It's about finding the pieces of the puzzle that are impacting a given individual and then looking from one person to the next to see how to recover their health. So things like immune dysregulation, autoimmunity, toxicity, these can often be very key players. And over the past few years, I've come to learn about the topic of the possibility of breast implants being one of these contributors to dis-ease in susceptible individuals. I'm very honored today to have Dr. Lu-Jean Feng on the show to talk with us about this very important topic. Thank you so much for being here today, Dr. Feng.
It's my pleasure.
As a plastic surgeon, what was your personal journey that led you to considering the role of breast implant illness in your patients?
My personal journey really began in 1991 at a FDA silicone in medical devices meeting. This was in February of 1991, where I met 3 key people, Kathleen Anakin, Sybil Goldrich, who were the consumer group called Command Trust Network that had all the patients with breast implant problems Their referral base was there. And then the other person I met was Dr. Pierre Blais, who is a biomaterials engineer for Canada. And one group, the Command Trust Network, had all these patients. And of course, I was very interested in exploring how to make them better. And with Dr. Blais, he gave me the key advice. You must remove all of the capsular material associated with the implants. And later on, I found this is the most important decrease in bioburden that I could give to my patients.
Excellent. What are some of the challenging health conditions where breast implants may be playing a role in terms of creating or contributing to a state of poor health?
Yes. The breast implant illness mimics many of the diseases you just mentioned. It mimics hypothyroidism. It mimics mold toxin illness. It even mimics sleep apnea syndrome. And certainly it has many common symptoms with Lyme disease. And in fact, many of our patients have concomitant Lyme disease diagnosis.
What percentage of the population with breast implants do you suspect have less than optimal health as a result of their implant? Do some people tolerate them if they don't have another health challenge, or are they potentially creating some degree of ill health for essentially everyone over time?
Yes, I think the patients that do come to me and seek implant removal, they have multiple symptoms. If someone just have one symptom, two symptom, or the beginnings of breast implant illness, they may not seek removal, simply because most of them may love their result and they would hate to give them up. So maybe there's a certain process of denial that occurs in the beginning before one recognizes their health is affected. And certainly people with more severe symptoms, there's no denying there's something that has changed.
What are some of those clues that someone with breast implants might observe that could be an indication to explore potentially having them removed or exploring them as a potential contributor to their condition? Are there some key symptoms that you observe when someone might have implant illness?
Yes, I can divide them up into local effects from the implants versus systemic effects. Local symptoms, in addition to contracture, people may not have any contracture at all, but local symptoms include difficulty breathing or difficulty engaging deep breath, neck and shoulder tightness and pain, numbness and tingling in the upper extremities. And systemic symptoms would be what follows these more localized symptoms, which include anxiety because you cannot catch your breath with exertion, fatigue because the work of breathing is increased, certainly peripheral neuropathy because there are neurotoxins in the implants. And there's a special group called basically immune dysfunction. So it includes effects on the GI tract with irritable bowel symptoms. In some cases, it's mast cell activation disorder. And of course, patients who have predisposition to autoimmune disease, they may have, in addition, a diagnosis similar to a autoimmune disease-like diagnosis.
Are there some people that are more likely to be negatively impacted by breast implants than others? So, for example, you mentioned autoimmunity. If someone has a pre-existing autoimmune condition, is that potentially a contraindication for getting breast implants in the future? What are some of those factors that might make someone more high risk for a poor outcome with implants?
I would commit to say that it's not just a previous history of autoimmune disease, but also a family history of autoimmune disease. The other is a history of irritable bowel syndrome, where there is more gut issues and gut sensitivity to different food substances. Those patients are in danger of increasing their sensitivity to various foods. People who have chronic fatigue syndrome, people who have fibromyalgia, people who already have, for example, thyroiditis, Hashimoto's thyroiditis. Certainly, if you have a history of Lyme disease or tick exposure, the Lyme disease may lay dormant until you get a breast implant. Then, because of the immunity dysfunction, it may reactivate the Lyme organism and Lyme disease.
Talk to us a little bit about the difference between saline implants and silicone implants. What materials are they made out of? Do the materials have the potential to create health challenges themselves? And is one potentially safer than the other?
Yes, you would think that saline implant is safer because it does not have gel bleed. The silicone implant definitely has gel bleed, despite the fact that the manufacturer has said that they have ways to block the bleed. And the reason we know that is when we look at the pathology of the capsules from gel implants, there are lots of macrophages in there. That's what distinguishes between implants that have gel bleed versus some other reaction. In saline implant, the shell does degenerate over time. And what you see in the pathology of these capsules is lymphocytes and plasma cells. You don't see so much the macrophages, but sometimes you see giant cells that surrounds actually different pieces of silicone that you can see with light microscopy. So both are problematic. What's interesting about the saline implant is that oftentimes when we take out an intact saline implant, they weigh more than the original fill volume. And so there's an autoinflation process going on. And I'm not sure how that occurs. Some people have said, well, maybe the valve doesn't work very well and there is exchange with body fluid. So the valve can go either in or out, but it's no longer one way.
For those people that are listening, maybe not familiar with all the terminology, what exactly is the process of gel bleed?
Gel bleed is the process whereby the smaller silicone molecules, well, silicone you can best define as a polymer. It's a polymer of carbon silicon bonds that are cross-linked together. The oil portion of the silicone gel has a shorter molecule. It only has maybe 4 or 5 links. The gel portion, where it looks like Jell-O, has a much longer chain, and there's more cross-linking between the chain. The shell has even more cross-linking structures between them, so that they form a much more stable structure. Now, the little oils can pass through an intact shell, and that is what gel bleed is.
Very good. That's fantastic. Thank you. How common is it for implants to rupture in the body? And when rupturing occurs, is it less of a problem with saline than if one has silicone?
I actually did a very big analysis of variance on risk factors of rupture of gel implants. This was, I believe, published in the early 2000s. Where we studied about 1,600 implants. The percent of rupture increases with time. The percent of rupture increases with capsular contracture. Those are the two huge factors that affect rupture. And of course, there are certain manufacturers. At the time when I did the study, there were like five or six different manufacturers. Certain manufacturers, when they use thin-shelled implants, have a higher rupture rate. And certain generations of implant manufacturing also has higher rupture rates. For example, the second generation of implant manufacturing, which runs from early 1970s to the late 70s, this group of implant has very thin shells, and their rupture rate is quite high within the first 5 years. Typically, we don't see, like today, we don't see rupture in the first 5 years, but this group, you probably see over 50% rupture in the first 5 years. Now, there are very few people with these type of implants now, but if I do encounter them, I definitely expect rupture, and usually it is correct.
And when there is rupture from a health perspective, then is the saline less of a problem than having the silicone itself rupturing into the body, or not necessarily?
Yes, it's less of a problem because when you have a rupture, if the rupture gets outside the capsule, the scar tissue that has enveloped the implant, the outside silicone exposure will elicit a greater granulomatous reaction. So you will have more intense macrophage, lymphocyte, and giant cell reaction. And physically, it actually forms a lump. And you will be able to see it on mammogram when you have an extracapsular rupture. And when that happens, it does eat away at your breast tissue because you do have to remove that. So the best kind of rupture to have is an intracapsular rupture. Unfortunately, that's a silent rupture, and the only way you can detect that is with an MRI, with a breast coil, or with ultrasound. But the MRI will be more sensitive in expert hands. And the ultrasound examination, of course, in expert hands can also be just as sensitive and specific.
How do you evaluate whether or not someone's breast implant is potentially contributing to their poor state of health? Are there specific tests that are run? Are there certain criteria that need to be met before you would surgically remove an implant? Or does someone have to make the decision to remove it and then observe to see if they do notice improvements with their health?
We do have a protocol. We do examine very carefully how the health change with respect to how soon after implantation, because there is certain implants present sooner. Other implants, like saline implants, smooth shell saline implants, tend to present later. The other thing is that we look at the patient's previous workup. What has been investigated? If their primary symptoms is GI, have they had a colonoscopy? Have they done food sensitivity testing? If they have fatigue, have they looked at all of their comprehensive metabolic? Have they looked at their endocrine? Have they looked at their thyroid function studies, not just TSH, but free T4, free T3, reverse T3, and the antibodies? If they had numbness and tingling in the extremities, have they had an MRI? Have they had any neurological workups? If they have palpitations, have they had a cardiologist workup? So we look at all these workups, and if there is nothing definitive, or if they have chest pain, a lot of people there's a chest wall pain syndrome. They may have gone to the emergency room and made sure that they don't have a heart attack and their heart is healthy. These are the workups that we look for. And if someone has never seen a doctor, we don't encourage them to come and get their implants out. As I said, we would like to see all the previous evaluations. If someone has if someone has Lyme disease like symptoms, we would like to see was Lyme disease diagnosed. If someone has fatigue, we would like to see whether there's hypothyroidism or adrenal fatigue or other issues, any other viral or mold exposure. If someone has GI issues, have they had a colonoscopy, endoscopy? Have they had even a small intestine bacterial overgrowth testing that could potentially contribute to GI issues? If they have eye problems, the eye problem is also very much a part of the breast implant illness. Do they have dry eyes? Do they have a retinal autoimmune retinal problem? If they have many sinus issues, have they have this worked up? If their sinus is clear, do they have just sinus allergies? If they have significant muscle and joint problems, we really would like to see a rheumatology workup. Or if they have rashes, hives, dermatology workup, and potential mast cell activation disorder workup. So these are all the things that we look at. I may have missed other things, but certainly also the neurological workup is very important in people who have numbness and tingling in the extremities or one half of the body. We really would like to see the neurological workup, such as an MRI, to rule out multiple sclerosis.
So it's a very holistic look that you take in terms of trying to figure out whether or not the breast implants may be a part of someone's health condition. Are there some labs that you might see, like an ANA or elevated CRP or SED rate or certain immune markers? Are there some specific things that might clue you into, well, this might be associated to the breast implants?
Well, there was a paper that was written quite some time ago by someone at the Scripps Institute. They looked at ANA in breast implant. They don't call it breast implant illness. This was in the 90s. They call it connective tissue disease associated with breast implants. And they found that actually the ANA go down. But in the current patient population, we really don't see any elevations in ANA necessarily. We don't see elevations in CRP. We don't really, there is no marker, unfortunately. I think simply because what we are looking at may be a toxin reaction. So I would be more interested in the future in pursuing how can we measure toxins, either carbon silicon compounds or certain heavy metals. I'm not sure, but somehow these molecules that has been dispersed from the implant create really havoc in the cells from head to toe.
So let's talk then a little about heavy metals. So do all breast implants contain heavy metals? Are there other chemicals in them that they might be leaching into the body as well? How toxic are the implants that we're putting into the body? And is the shell of the actual implant, if we look at both saline and silicone, for example, is the shell potentially equally toxic? What's in these implants?
Well, there was a paper published on platinum by Ernest Lakisa some time ago. He was a forensic pathologist, and he tests, and of course they determine the cause of death. So he would take hair samples and look at all the drugs that could potentially cause the death of that particular diseased patient. What he found was that in patients who have breast implants, that there were very high platinum levels in the hair. Now, at the time that he was doing this, I think he was looking at both the second and the third generation implants. I haven't had contact with him lately to find out if there's been other testing done on patients' implants. I think this is one area that's really much needed. From what I understand, aluminum can be in there, arsenic can be in there, and perhaps other heavy metals could be in there. But because we don't really understand the manufacturing process and what is currently being used, and whether these gummy bear implants, where the gel is much more stiff, I've heard that people say that more heavy metals had to be used in order to create a stiffer, more viscous gel. See, these are not things that we can easily study. For example, as physicians and surgeons, you rely on pathology. Pathology only look at cells. Pathology does not look at chemicals. So you really have to rely on people who can do chemical analysis in order to get to the bottom of what is making people sick from implants.
Can sensitivity testing be performed before an implant is even placed? So in the dental world, for example, I know there's certain compatibility tests to see if your immune system might react to certain materials that a dentist is considering putting into the body. I know there's a silicone sensitivity test through Eliza Act Biotechnologies. I'm wondering, are any of those types of explorations helpful before an implant is placed to see if someone's immune system might be reactive to the materials?
The Eliza test for silicone came under heavy review in the 90s during the lawsuits, during the class action lawsuits. And they fought over this in the courts. Basically, the manufacturers trying to discredit them, and the plaintiffs trying to prove that that actually is a good test. I actually don't know how good is it, because it has to be, because Eliza is very, very specific. So how are you capturing what is coming off the implants? We don't really know what's coming off. What's coming off the implants in order to specifically test for your reactivity. So, the missing link is, what is the chemical that is coming off the implants? And I think that research has to be focused on that before we can even develop a sensitivity testing.
What are some of the more common microbial issues that might be observed with implants? Can the implant itself serve as a site in the body for different pathogens to create communities and biofilm communities? And if so, would those be on the surface of the implant, or can some of these microbes actually get into the implant itself?
Well, at a most gross level on the light microscopy of capsules, when we have an active infection, we will see white cells. But if there is a subclinical infection, we wouldn't even call it infection. If there is subclinical presence of microbes and biofilm on the implants, at this point, they're not routinely studied, because as we know, in order to see biofilm, you need scanning electron microscopes to see that. So I think this is probably unknown territory, even though even though there have been culture studies around implants, and they have found that some people have the skin flora organisms around the implants. And what role do they play? I'm not sure. I just know that we don't see a lot of white cells around implants. So there is no active infection in most implants that were removed. I would say 99% of implants that are removed do not have active infection. The breast does not exhibit any redness, heat on the surface like you would see in an implant infection. So that's a good question, and not sure if I could answer that without any additional, more sophisticated studies.
Talk to us a little about the foreign body reaction. Can the immune system have a foreign body reaction to an implant, just like it does potentially to a microbe that might be somewhere in the body? Can the implant be a trigger for systemic inflammation and immune activation inside the body?
Well, in terms of systemic activation, I can say this, that when you get rid of what is the foreign body reaction in the breast, you reduce some of these immune dysfunction. We have patients who have severe mast cell activation disorders in terms of the GI tract, where they have very limited food items that they can tolerate. Otherwise, they would get either tongue swelling or rash. When you remove the implants and capsule, they can tolerate more food and they can begin to heal their gut so that the immunity in the gut becomes more tolerant. In other words, there is some balance between suppressor cells and activated immune cells.
And so this foreign body reaction to an implant, is that essentially the immune system reacting to something that it does not expect to be in the body and thus then creating inflammation potentially?
Yes, because we see plasma cells and mature T lymphocytes around implants. And that's very common. That's virtually around every implant. Of course, some implants will have more of that. The older implants, the implants that have more degeneration of the shell, you will see more of that. Systemically, other than looking at patients' symptoms and how it goes away with complete removal of the capsule and implant, we really don't have any ways to measure their potential response, because every patient's response, you have to remember, is different. Not everybody is going to get mast cell activation disorder. Not everybody is going to have an autoimmune-like symptoms. It could be just immune dysregulation of various types, whether it's a IgE mediated or IgG mediated. We have patients that have a common immune deficiency syndrome where their IgGs are very low, and after the implants are removed, the IgG titer got better. So it's very interesting. I think that because of the varied presentation of the breast implant illness, that's not a reason to just give up on it, because everybody is different and we all have different SNPs in our ability to detoxify. And as you said, I like the many approaches. Say, for example, Dale Bredesen, his approach to Alzheimer's is a lifestyle medicine approach, and I totally agree with that. This is what I tell my patient. You have to reduce all the toxins in your daily exposure, such as in diet, such as in the air that you breathe, such as in the house that you live in order to help your body heal. And healing begins with having micronutrients. That's going to come from a good diet. Having proper exercises, that's going to help in many different aspects, and having the right supplements in people who have MTHFR SNPs, so that they could utilize their folate and their cobalamins and B12 in order to process, in order to continue cellular function. So I think that's. I'm glad you like my approach, which is holistic, and I think this is the kind of approach that has to happen, because there are no drugs. There are no drugs to treat this. Just like we have many diseases today that have no drugs to treat. Many, chronic fatigue, fibromyalgia, Alzheimer's, to name a few.
Yeah, it is my opinion that detoxification in our modern world is the most important thing we can do to improve and maintain our health. So when you say detoxification, as a plastic surgeon, you make me smile that you think about things like detoxification, because it is so important to look at everything holistically in order to get well. Let's talk a little bit about someone with Lyme disease, maybe mold illness, also has breast implant illness potentially. Does one generally come before the other? Do I maybe have Lyme disease for a long period of time, and thus my immune system then is not tolerant of a breast implant? Is it possible that I've had breast implants for many, many years that's created some dysregulation in the immune system, so that if I then get a tick bite or an exposure to a water-damaged building or something to that effect, that I then can't respond in a healthy manner to that because I've had this immune system dysregulation? Or can it be either of those? Does one necessarily come before the other?
I think you hit it on the head. It can be either, because I've seen patients who have Lyme disease who are being treated, but their physicians tell them, you're not responding normally. I think you should get your implants out. If you look at Horowitz's book on how do I get better from Lyme disease, in there he talks about getting rid of toxins as one of the key factors. Well, he didn't write in breast implants, but I hope that after publication of some of the studies that we have done, that all medical specialties will look at breast implant as a potential cause for the various manifestations of diseases, internal medicine diseases. So yes, or as you said, in terms of Lyme disease, somebody could get the implant, they don't have Lyme disease, and then later develop Lyme disease. Then in order to really help them respond better, they do have to take their implants out.
I want to talk a little bit about the idea of biofilm and capsular contraction. So is there a connection when we talk about capsular contraction, the scar essentially that forms around the breast implant? Is that entirely scar tissue, or is there a biofilm component that creates that contracture as well?
There actually is a paper that I've just recently read on biofilm and capsular contracture. In that particular paper, they say, and using scanning electron microscopy, they say that patients with capsular contracture, 56% of them have biofilm, presence of biofilm on the implant, whereas patients without contracture, less than 10% have biofilm present. So yes, I think in the area of contracture, in terms of causation of contracture, biofilm may play a very significant role. I can tell you, people with breast implant illness, they don't necessarily have contracture. I think contracture is perhaps a separate issue, a separate complication phenomenon associated with breast implants that are not consistently associated with breast implant illness.
And is contracture then associated back to the foreign body reaction that we were speaking about a few minutes ago? Is the contracture or the capsule created as a way for the body to protect itself from the implant. Is that essentially what's happening?
Well, some of the studies on contracture say that there is activation of myofibroblasts for whatever reason. The myofibroblasts, and certainly two other conditions can bring on contracture that's well known to plastic surgeon. One is bleeding, and the other is infection. They can, even though if you clear the infection, the implants are still at risk. And what's interesting about contracture is that once you have contracture, no matter what you do, you're going to get it again. It's impossible to get rid of it. It's just how your body responds. So it's more than just infection. It's something about the immune system. And did you know that they can actually relieve contracture conditions with Singular? Actually, Singular has a very beneficial effect. It'll actually soften the capsule. So it does involve, contracture process does involve different pathways of the inflammatory reaction. And I find that very interesting. The Singular can actually help patients.
I find that interesting as well, because it's also one of the things that commonly helps in people with mast cell activation. So you wonder then, is some of the capsule the result of mast cell activation, that immune response then that's creating a capsule? Did I understand correctly that if someone has capsular contraction, if they have the implant removed, the capsule removed, and another implant placed, that they're still at a higher risk for having yet another capsular contraction in the future because of their unique immune system?
Yes, yes, I do believe that, and the literature does prove that.
Let's talk then about the explant process itself. So when you're planning an explant procedure, what are some of the things that you tell your patients to do pre-procedure, post-procedure, to put things in place that will optimize their recovery and their healing from that process?
The pre-procedure supplementation is good for just about every surgery. You have to decrease or stop any medications or supplements that will increase bleeding, including food as well. Wine and alcohol, they both can increase bleeding. Then the other aspect that I expect patients to do and that I provide them are different micronutrients that they must have in order to heal. So your healing burden is much greater when you have surgery. Because the explant surgery involves the dissection of scar tissue, and in areas that have a lot of blood vessels, the control of clotting is very important, that you must be able to clot. Otherwise, the bleeding complication becomes too often.
What does the actual explant procedure consist of? So how long does it take to do one? What exactly are you doing? And is the person always under general anesthesia?
Most of the implants are actually under the muscle. So you have to take the capsule off the chest wall. So what does that mean? That means you have to remove the capsule from the ribs, from the external intercostal muscles, and you have to dissect it all the way up to as far up as the clavicle at times. But the most common imprint of the implant on the chest wall is from the sixth rib to the second rib. So on the left side, after you clear the scar tissue, you can actually see the movement of the heart. Now, the heart doesn't just pound. The heart motion is a rolling motion involving first the atrium rolling into the ventricle. So you see this rolling motion when you're doing open heart surgery, which we did as part of our training as a surgeon. But you don't see this rolling motion unless you're very close to the heart and to the pericardium. So when we're doing this dissection on the chest wall, we are very close. We're very close to the lung. We're very close to the heart. And that is the reason why we have to have general anesthesia, because we can't have the patient move. Otherwise, we'll be in the chest, and that we can injure the lung or injure the pericardium. So it's a pretty involved process. But the other important obligation I have towards my patient is that I have to restore the normal anatomy of the breast. When the implant is placed under the muscle, the actual inferior origin of the pectoralis major muscle is cut. And many patients actually have a decreased upper extremity strength. So in order to regain that strength, you must repair the muscle, because the muscle, once it's cut and it's housing the implant, the edge of the pectoralis major muscle is actually attached to the breast. So when the pectoralis major muscle is moved, the breast moves. The breast shouldn't move when you contract your pectoralis major muscle. So when you repair it onto the inferior origin, which is at about the fifth rib, you not only can potentially restore function, but also you provide an extra layer of thickness, which will make the breast look more normal. Otherwise, your breast, especially a thin breast, is sitting on ribs. And that's a very, very deformed look. So these are the two reasons why I think muscle repair is so important, both functionally and aesthetically. So in addition to taking out the scar tissue, we also look for additional scar tissue beyond the capsule, because the scar tissue doesn't belong in the chest. So in order to restore full function of your chest wall, which is breathing, we really remove all the scar tissue on the intercostal muscles. And I think this really is what is responsible for changing the symptoms of patients that have breast implant illness, because it's a more complete removal, and it's with attention to actually the function of the chest wall.
How long does that entire process generally take?
In general, between 2 and 3 hours. It's not just removing it, but we have to make sure the patient doesn't bleed afterwards, because it's a very highly vascular area. So oftentimes during surgery, we will make sure that when we're looking to do hemostasis, that we have the blood pressure, the anesthesiologist bring the blood pressure to baseline, so that you're not trying to do hemostasis with the blood pressure very low, then you would have missed many bleeding points. But once you bring the blood pressure up and you see the bleeding points, it's a much more thorough hemostasis. And I think that's really important, because these patients have enough complications already. And I feel it's very, very important that the surgery be done with as few complications as possible.
When you remove a breast implant, what do they generally look like? Are they generally still the same color inside? I've heard some people talk about potentially seeing a darkening of the inner contents of the breast implant. Can we have the potential for fungus or other things that are growing in the implant? My understanding initially was that potentially does happen in some people, but my understanding from listening to some of your earlier work is that that's fairly uncommon. So can you talk, if someone has an implant that comes out, what color is it generally? And if it is dark, what might be the reason for that?
The older the implant, let's define this. A new implant would have a certain shine, and it's translucent, and it's actually very beautiful. The older ones, it would look more cloudy, the cloudiness in the shell, but not necessarily particulate matters in the implant fill. This could be either saline or or a gel implant. Later on, as the implant becomes older and there's more exchange with body fluid, it turns yellow. So those are some of the conditions. The other thing about the capsule, the shell material of saline implant is that oftentimes there will be sand-like particles. Now, silicone can turn into silicon dioxide, which is sand, and that's highly inflammatory. So oftentimes I can see specks of calcification on the implant shell. Regarding mold, I have seen very few mold, probably just one case of mold in my whole career, which is, I have done about thousands, maybe 5,000 explants. Mold doesn't grow in anaerobic conditions. The saline implant and gel implants, there's not a lot of oxygen in there. So I don't expect them to grow readily. If it's introduced at the time of the implantation, and if you introduce a lot and then there is enough inflow of proteinaceous material through a defective valve or through other exchanges within the implant shell, yes, of course, that can grow. I have tested many particulate matters that are floating in saline implants. Most of them are blood. And then we would also submit this discoloration to pathology to see if they see fungal organisms. And they don't see it. They just only see it as hemosiderin or some type of a red cell breakdown.
Once an implant is removed, is there some testing then? Sounds like there is some testing that can be done. Is that generally done? Are there specific labs that will evaluate the capsule and the contents of the implant?
The only available testing right now is pathology examination. As I said earlier in our podcast, that we need more chemical analysis. And I believe Dr. Lakisa has a lab called Expert Tox. Certainly, patients can utilize that lab. I have not talked to him. I've met him before, but we can certainly, in the future, develop a panel of testing of likely chemicals in these implants or in the capsule. In the capsule would be more important to find out.
You mentioned earlier that Singular potentially can help soften some of these capsules. Are there other immune modulation techniques that can help people with breast implant illness? For example, low-dose naltrexone, low-dose immunotherapy? Are these things that potentially can be used before or after the explant process itself is done to kind of calm down or modulate the immune system?
Many patients are actually on low-dose naltrexone in order to control their pain and to help their breast implant illness, but it really does not get rid of it. There is one physician back in the 90s. He was a neurologist named, he was at the Houston Baylor Hospital. I can't recall his name right now. But he actually used chemotherapy drugs. And certainly the chemotherapy drugs would work in terms of getting rid of all of the symptoms associated with breast implant illness.
Wow.
But I think that's too drastic a measure. I still think that the less invasive would be better. That my approach to treating breast implant illness is still complete capsular removal and the implant removal, no replacement, and better diet, better supplements, better lifestyle, decreasing stress, introducing exercise whenever possible.
What is the general course for a patient after removal of their implant? Do most of the patients see a systemic health improvement? If they do see improvements, are they generally immediate? Do they take a period of time for the immune system to calm down? And then after the implants are out, what are some of the additional things they should do to build upon that to move their health forward?
The most immediate improvement is breathing. And that usually is followed by lessening of the brain fog, lessening of the anxiety, and lessening of the fatigue. The more difficult residual problems, one is the GI issues, because sometimes it may require the patient to undergo additional sensitivity testing so that they can avoid the food substances that can be causing their rashes and other symptoms. And it could be as common as mushrooms. And I have a patient who had significant improvement, but she had persistent rash across her upper lip. And it's only when she stopped eating mushroom and she found that she was sensitive to it that she got out much better. So a lot of it may require elimination. It may require doing the FODMAP, or may require doing a plant-based, no gluten, more raw vegetables. But it's different with every patient because it really depends on how much their GI system can tolerate different food substances, and what diet is going to give them the most micronutrient.
My observation over the years in people with Lyme disease is that there's generally a predisposing detoxification issue, that people are not able to detoxify as optimally as would be ideal to support their health. You mentioned MTHFR earlier. Is there a connection between an inability to detoxify or a lesser capacity to detoxify and a person's potential for developing breast implant illness?
Many patients have the SNPs associated with MTHFR. If you think about how important methylation is in the detoxification reaction, if their enzyme activity is reduced and they have onslaught of toxins, their system can be easily overwhelmed, and the toxins can spread to different parts of the body and create illnesses. So yes, I don't know if people who don't react to implants, do they have less? Do they have a more healthier MTHFR enzyme activity versus people who have reaction to implants, whether they have reductions in MTHFR activity? I mean, that's a very, very good question.
I know in your clinic you do a lot of different types of things to support detoxification. So after breast implants are removed and there is focus on detoxification, what are some of the tools that you like to use in support of optimizing detox?
We have a professional kitchen. The original reason for the kitchen, number one, is we want our staff and ourselves to eat healthy. But it's really for educational purposes, because we want the patient. We actually give patients salad and soup after surgery, and we ask them to also continue that and see if they feel better. Many of them do feel better, unless they're already on a super healthy diet. But I think the diet actually plays a significant role in getting better. And what's interesting is that there are patients who relapse after explantation. And when we do our follow-ups, it's very important in this in treating breast implant illness for the physician to follow up. When we look at when we examine what could be the reason for the relapse, oftentimes we find that the relapse is due to indiscretion in their food intake. So when they and the patient will tell you, yes, when I eat healthier, I feel better. This symptom doesn't occur, or that symptom doesn't occur. So we always encourage them to stick with vegetables. The vegetable family. If you can eat it raw, great. If you have to have it cooked, that's fine too. That's better than not having it. And definitely not eating processed foods. And avoiding gluten and dairy is a common practice, because that generates potential immune response in itself.
I know that you mentioned things on your website like sauna therapy, ionic foot baths. That led me to the question, if someone has not yet had their implants removed, is there potentially any contraindication with sauna therapy in that the heat itself could potentially lead to some additional leaching of materials into the body, or is that something we're not concerned about?
I think I would be concerned about that, because there are different conditions that can increase leaching out. I mean, mechanically, we definitely know that mammograms can potentially increase leaching of implant material. And certainly in the heat, some people don't tolerate heat. The heat of a sauna can also potentially do that. So I generally recommend people not to do the infrared saunas until the implants are removed, so that some of the residual toxins can come out through sweat. Yeah, if you look at the 9/11 rescue worker, their detox regimen, specifically the Hubbard protocol, they would utilize a combination of using niacin and exercise and infrared sauna in certain order, in order to increase the fat-soluble toxins to be mobilized and excreted through sweat. And I think some of that may actually work for some patients. I know that there are patients who try that before the implants. They don't feel a difference. But after the explantation, that helps them as well.
In cases where there's been an actual rupture of silicone into the body, my understanding is that can be a little more challenging to detoxify, and that pieces of silicone need to be surgically removed. But then if there is any silicone left behind, is there an ability to detoxify that from the body?
I believe there is. They are more challenging. However, it again depends on the patient. Some patients can tolerate certain degree of rupture, others do not. So for the patients who feel some improvement from removal of the ruptured implants, it's I don't have any other ways other than to decreasing toxin exposure through food and through their environment.
So if there was silicone leakage into the body, the detoxification strategy would be the same as if there were not, is what I'm hearing.
Yes, that's correct.
Beautiful.
Yes.
A listener had asked if there is a connection between breast implants and a future higher potential risk for any type of cancers due to the toxicity that they may be introduced into the body. Do we know if there's a connection there?
There's no data on that other than the anaplastic large cell lymphoma, ALCL, which the FDA is, everybody is concerned about that. And that particular cancer is associated with textured surface implants. Now, the texturing is actually very immunogenic. I did a paper on flow cytometry studies of the fluid around these type of implants, and we actually found the activated lymphocytes present, meaning they express, there's a marker they express, it's called HLA-DR, that marker was very positive in around the texture surface implants. As you know, the HLA-DR marker is also present in the joints of during rheumatoid arthritis flare-ups in patients with RA.
Yeah, that's very interesting because there's also Dr. Richie Shoemaker's work talks about HLA-DRs that are predisposing people to certain biotoxin illnesses, such as mold illness, such as Lyme disease. I know you have a number of patients that have had Lyme disease. We've talked about that. Do you also see people that have mold illness from living in a home, working in an environment that has a water damage and thus a mold overgrowth? Do you see those types of patients in higher numbers dealing with breast implant illness as well?
I have seen patients with mold toxin illness, and that there was a history of mold exposure, and how they, by moving to a better environment, some of the symptoms went away, but there's still residual symptoms, and probably because the implants are still present. So I do think that, as was pointed out in the Lyme community, you really do have to look at all of these issues, potential toxin issues, mold, things in your teeth, your mercury or titanium dust in implants. There are many. If you look at Bleeding Edge, there's that movie. A lot of the joint prostheses can form small dust from the prostheses that can make people also ill.
You've mentioned in our conversation the idea of mast cell activation syndrome. Someone that I had spoken with recently that was dealing with significant mast cell activation syndrome also was dealing with Lyme disease, had her breast implants explanted, and her mast cell symptoms completely resolved in a very short period of time. So how often do you feel that in your patients that have breast implant illness, how often do we suspect mast cell activation is a piece of that condition?
I think it's more often than suspected, because I think if you look at the symptoms associated with mast cell activation disorder, there's like about 20 symptoms. A lot of them are part of the breast implant illness as well as some of the other illnesses we mentioned. But the stronger history will be, for example, people developing hives, people developing rashes very quickly, people having near anaphylactic reactions when they eat certain things. So if you look at the criteria, if they have multiple symptoms, and that some of it is due to food and some of it due to what's in the air, that you always have to suspect that. And, oh, by the way, in some of these patients, I have asked the pathologist to do immunofluorescence staining for mast cells. And they, by and large, found them in the capsules. But we don't have the controls so that we can do a comparison. If somebody has no symptoms of mast cells, if we do a mast cell immunofluorescence staining, would they have less? Right. So that is the question that needs to be answered. So just by seeing mast cells in capsules, we don't really know this true significance of it.
Another question that a listener of the show sent in was around the idea that we know in mothers, let's say, that have a number of dental amalgams, that potentially the future child is affected by heavy metal toxicity. Is there anything that we know around a mother who has breast implants and those toxins potentially being passed to their future children?
One thing that I have observed that's of interest is that oftentimes when the mother is sick, the children could also have increased allergies to dairy, to the milk, or to other food substances. I believe that stillbirth in the post-market FDA paper by Dr. Clemens show that stillbirth has an increased incidence in breast implant recipients versus normal population.
In someone who might have lost a breast due to breast cancer, are there options for improving their cosmetic outcome that don't require putting in an implant? Or are there safer implants or stem cell therapies? How do we achieve a better cosmetic outcome in breast cancer without the risks that implants might introduce?
Part of my earlier career was devoted to autogenous tissue reconstruction of the post-mastectomy patient using microvascular techniques. There are so many flaps now that can utilize free-flap techniques that can be moved to the breast and create a breast without implants, such as the tram flap or the deep flap, deep inferior epigastric perforated flap, such as the superior gluteal or inferior gluteal perforated flap, such as the medial thigh flap. These are all very, very excellent options for people who want to replace their breast that's lost through cancer. It's just that there are not that many plastic surgeons that are trained in this method. I personally had done a microvascular fellowship in my training, and in the first 15 years of my career, done about 300 of these free flaps for breast reconstruction. I still feel that is the best reconstruction for the woman who's had breast cancer who wants a replacement of their breast.
Very good. Thank you. We've talked a lot about the importance of diet. Tell us a little about FengFit foods, and is that something that's available to the general public that they can order and access those foods, or is that limited to your patients?
Oh no, our foods can ship anywhere. So FengFit Foods is basically a vegan style cuisine, and it uses very little heat. Or in other words, we use more water-based cooking for soups rather than sauteing, baking, which all potentially increases advanced glycation products and therefore C-reactive protein in the blood. So we have great salads that utilizes lettuce or greens that have very high nutrient density, such as kale, watercress, arugula, etc., and cabbage. But we want it to taste really good. So when people come, we want to introduce them that really healthy food can taste wonderful. That soups, healthy soups that can taste like chicken soup can actually be vegan. So it's just, and it's a real challenge to chefs that are committed to healthy cooking to try to find alternates of ingredients that are healthier. So yes, we can ship, and many patients will come and actually put the food in the ice boxes and take it back to their homes. I hope more people will learn the cooking method, and more people will learn how to plan their diet.
So as we come down to our final two questions, if people are interested in learning more about your work or about the topic of breast implant illness, what are some resources that you might suggest for them?
Well, they can contact our website. They can look at our Instagram. Those are the primary sources at this point. I am writing a book on breast implant illness, which actually will help other people potentially diagnose this illness, because it talks about the different manifestations and how the illness begins. And there's a little bit of history behind it, a little bit of science, because we just finished doing our study on the pulmonary function of the lung before and after explant, and what happens to lung function over time. I think these are very good differential diagnoses for the internist or the pulmonologist. And I hope that once the book gets out, people will read it and come to a better understanding. And certainly continuing research, continuing searching for the real answer behind breast implant illness is paramount.
My last question, what are some of the key things that you do on a daily basis in support of your own health?
I exercise. I eat FengFit foods. I love our foods. I love the chef. And I also have to relax on the weekends. I pay attention to sleep. I pay attention to ketosis. I think that ketosis does make you think better. And I thank Dr. Dale Bredesen for bringing that principle out. So if it's good for the brain, it's probably good for the body.
Beautiful. This was so much fun for me. I love your passion. I love your holistic approach to this important conversation. I know lots of people will benefit from all the great information that you've shared with us today. So thank you for taking time. I appreciate it so much.
Well, thank you so much for the opportunity to talk to you. The pleasure is all mine.
To learn more about today's guests, visit FengClinic.com. That's Feng, F-E-N-G, clinic.com. FengClinic.com. Thanks for your interest in today's show. If you'd like to follow me on Facebook or Twitter, you can find me there as Better Health Guy. To support the show, please visit betterhealthguy.com/donate. If you'd like to be added to my newsletter, visit betterhealthguy.com/newsletters. And this and other shows can be found on YouTube, iTunes, Google Play, Stitcher, and Spotify.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.